So I'm going to try and keep this very brief because I think we've heard incredible consistency today in the messages both in the first and the second session. And I'm just going to kind of briefly whip over some of those themes and then kind of get to some, if you like, conclusion. Obviously, we began with the Minister issuing us a challenge about what we can do. And I think we've all thought about that and lots of discussions come up, but I think, Minister, it's also fair enough to say about how can we support what you want to do, and I'll come back to that at the end. So Barry gave us a really useful overview of both the data on alcohol and obesity and really cut to the importance of data itself. And I think that's something that came through in a number of the speakers and really a critical point is that we need to base what we're going to do on high quality data, on high quality evidence, and we need to have evidence about how it's working. And that's really, that really cut through a lot of the discussions. Barry also highlighted the importance of understanding that investing in health is a cost saving, that we need to, if you like, change the debate around whether health is a cost or an investment. And the data that came through that he presented really identified some particular high-risk groups and communities, and I think some of these discussions came through in subsequent presentations, but perhaps not enough. So both with obesity and also with alcohol concerns, the three particular populations that were pointed to be at high risk were Aboriginal populations, those not living in the metropolitan areas, and also low socioeconomic groups. And I don't think we really necessarily got through to those points, and I'll come back to that. Jane, of course, gave us the kind of how-to about obesity and really identified a number of major interventions that we could focus on, gave us the idea that we need to firstly have a policy on obesity, that there is a clear list of things to be done that include things like marketing, particularly the use of billboards, advertising on state property. These are things that could be done, and she really highlighted some things that within the West Australian context are relatively easy. Kilojoule labelling, the implications of planning laws, and that's that burger off concept. How do we enable both the adjustment of planning laws and then enable local governments to implement them appropriately, responding to what communities want. But she also identified a number of challenges that I don't think we have a clear solution to in the absence of a national approach around sports marketing, around how the industries regulate, and this whole concept that again came through in the alcohol discussion, that self-regulation is no regulation. That there are problems with the health star rating. It's a great thing overall, that it needs to be refined. And someone pointed out to me, if you go to Coles, you buy a packet of cornflakes and it's got 3.5 stars. You buy a pack of whole unroasted macadamias, which is a reasonably healthy food, it gets 1 star. So we've got some work to be done on that. And if you go to the traffic light system at canteens, that sweetened milk drinks get a green light, as do juices. So there's a bit of work to be done there. The other thing that really I think Jane identified is why is it so slow to get things done. And this comes through to the Margaret Chan quote, which I thought was wonderful. It's all about big food, big soda, big alcohol. And that's if you look at all the stumbling blocks, both in the obesity and the alcohol discussion, it's not about whether or not there's community support, it's about what the obstructions are from the commercial interests. It's all about vested interests, and I think it came through loud and clear that the community really wants to see things change. And so that's really, I guess, Minister, I'll come back to this, but there's no concern, I don't think, that you should have around whether or not there's going to be popular support for being bold and doing something significant, because both in the obesity issue and in the alcohol issue, the public support is kind of like where we got to with tobacco, that everyone realised that they want something done about it. We also talked about obesity as the new normal, and that's a big issue. And we did still come back to this whole issue about, where we're going to spend our dollars and should we spend our budget on prevention. And again, that comes back to my concern as to whether we're using the right language, because it's not a spend on prevention, it's an investment in a net cost saving and economic building issue. We got through the panel in the morning session. Maurice identified the need for a comprehensive approach, which I think we very much heard that. We heard the message about local government being here to work with us. Wendy really gave a wonderful presentation around the issues of obesity in Indigenous communities. I loved her quote around, well, the statement I wrote down, which was that we need to look at obesity through the lens of environmental and social determinants and the accumulated effects of history. And I also love the idea of having a champion in putting Mary G on a diet. I thought that was a great thing we should do. And the other comment I loved was that when we look at the social determinants, it's often seen to be through a negative light. We should be looking through the cultural determinants, which is really a strength-based approach. There were a number of things that weren't touched on, and that's because inevitably in a day like this you can't do everything. So some things that struck me that perhaps we could have spent a bit more time on if we had the time were the issue of portion sizes. And that comment that I think Jane mentioned around that I'd noticed that, you know, when I was a kid, plates were this big, and then now they're this big. Back then, they got this big thanks to, I think it was Nouvelle Cuisine. You know, you get this big plate with a little bit of food in it. The plates haven't changed, but the food now fills the plate. And so what's the opportunity to, whether it's through regulation, through working with manufacturers or through health promotion, look at the issue of portion sizes. We didn't talk enough, I don't think, about physical activity. We talked a bit, but we didn't talk enough about it. And you know, I noticed, for example, I think Perth is a fantastic cycling culture. I think it's wonderful, but it's a sports cycling culture. And you look at the picture of Bogota, I think it was shown, everybody was there just cycling to work or to school on their little treadly. And that's perhaps something we also need to think about in this town. It's not just about getting in your Lycra and going at a gazillion miles an hour. It's also about how do we encourage people to just get to work and get to school and back. The built environment, again, got some attention, but not enough attention, because we know that there's a lot that can be done in the built environment to improve walkability, to improve the mix of the types of developments we have, so that we don't have the mall and the industrial section. We know that if you have mixes of developments in together, that is associated with much better physical activity and that people have a much better lifestyle. And in the obesity bit, what's the role of the health system? Again, I don't think we really focused on that enough. We talked about the importance of hospitals and fast food joints and sweetened beverage sales, and that's really important. But we don't talk enough about the role of the medical people, the health people themselves. And we know from the tobacco discussions that it's the role of a doctor or another health practitioner talking to someone about smoking and talking to someone about their diet actually has a very significant impact, and we don't train that enough and I certainly got very little training myself around lifestyle nutrition, for example. So I'll come back to the final comments, but just to move on to the afternoon session, I think we really, through Steve's presentation, you know, got the recipe again, and it was really reinforced. It's about availability, and Tanya really highlighted nicely that there's two types of availability: physical availability, you know, ease of access, proximity, legal age for drinking, and economic availability. And Minister, I don't think you're going to find anyone here who doesn't think you should introduce a floor price tomorrow. So go for it. Then we talked about the other things that could be done. And again, Steve highlighted the importance of data. And I think we also heard that from Terry, that whatever we do, we're going to have the data. Even if it's a policy that we're not so convinced about, we want the data to see whether it's working. So availability, minimum legal age, trading hours restrictions, and it strikes me that none of this is actually that the majority of the population is going to oppose. It's opposed by various industry sectors, but we're not talking about changing people's lifestyles on the whole. Advertising, engaging the community, having some KPIs, all of those things are important. What I think is also critical here is that, and we talked about this with the obesity, we need to be singing from that same hymn sheet. So that's what I loved about the afternoon session, is there was a set number of things that kept coming up, and there wasn't contradiction. So I think we've got a pretty good message to sell. And there was also this discussion around local hotspots, if you like, local groups, and how we can empower local communities to take control. If I could identify a couple of gaps I think in the discussion this afternoon that we'd like to spend more time on. I think that issue of alcohol in Aboriginal communities didn't get enough attention. Terry, thank you for raising it at the end. But I think it's also, as much as it's unfair to paint alcohol as an Aboriginal issue, and I couldn't agree more, I think it's also important to recognise that alcohol is doing a lot of damage in Aboriginal communities and that there are places that are really stepping up and trying to do something about that. How do we deal with that? And that also comes into the other big gap, which was we didn't really discuss. I think most of the discussions around alcohol seemed to me to be a very metropolitan discussion. We didn't really talk about alcohol in regional centres. And it comes back to my discussion in the morning. You know, if we want to deal with alcohol in some of the Pilbara towns, particularly those that have a significant mining community as well as a significant Aboriginal community, then how do we really empower that discussion? How do we control the vested interests? And how do we potentially look at some really the hard things, which is like the sort of regulations that Fitzroy Valley brought in and that Horse Creek brought in? How do you do that in a place like Port Hedland or Karratha? So I think those are areas that we need to tackle. But to come back to the critical issue, I think there's a small number of things that could be done pretty quickly that you will get remarkable support for. And so the final comments I guess I want to say to you, Minister, is that we feel like there's a bit of a momentum here that you've really started, and so congratulations to you. You've got to make things a priority. I think you've identified that there are two things that are of interest to you, obesity and alcohol. That needs to be followed up. We're here to support you, but if you really want to do something about it, you have to make it very clear that these are priorities for you and for this current government. That I believe in both of those issues, the community is taking the lead, and now it's up to government to catch up to what the community actually wants. And we need to learn from what happened with tobacco, that you just have to be tough and take on the industries because the community wants something done. That we need comprehensive approaches. We need to get in early, particularly getting those kids before they start drinking, before they start on their patterns of poor nutrition and poor physical activity. And I went through that list of things that we recommended this morning and this afternoon, and I couldn't find anything that's actually that expensive. And I know that when you talk to your treasurer, he's going to say, well, don't come to me with anything that's going to cost any money. Well, I think most of this doesn't actually cost money, and some of it gives you a bit more money in your coffers, and some of it saves money in the long, well, it all saves money in the long term. So I think in the Sustainable Health Review, we have an excellent template to do something significant, to build on the already great work that's happening in the departments, in the community right now. We've heard some fantastic things that are happening in Western Australia. And I personally, and I suspect this room would urge you, Minister, to be bold, to be willing to step up and say, no matter what anyone else is doing, we're going to take this seriously. And you will find that everyone in this room, and I suspect the majority of the people that we can bring on board, will be behind you. So go for it. Thank you.
Thank you, Jonathan.